Well, back to school season is here, and so is the return of fall sports. We're here with Dr. Yakin at Advanced Orthopedic Specialist. We're going to be talking about fall injuries when it comes to sports. We know a lot of kiddos are back to playing sports this fall. Dr. Yakin, what's some common injuries that we as parents will see?
Well, we'll see, a lot of different injuries, of both upper extremity as well as lower extremity injuries. Particularly with football, we'll frequently see knee injuries like meniscal tears. It's a little cartilage tear in the knee. You also see, unfortunately, ACL injuries with both football and soccer, and those are season-ending injuries, of course. Those are kind of big injuries, and when it happens, you kind of know that something's really wrong. As far as the upper extremities are concerned, you see things like shoulder dislocations, AC sprains, which people refer to as a separated shoulder, and also a lot of ankle sprains this time of year.
Is there anything you can do preventative to keep those injuries from happening?
Well, most of the time, no. I mean, those are, when you're talking about cutting and pivoting sports or contact sports or collision sports, things kind of just happen sometimes. But, just staying in shape as best as possible and having your muscles in good shape. And of course, those are the reasons for fall training camps and things of that nature to help that. But there's really not a good prevention for some of these things. It's just you get tackled, you get landed on the wrong way and tear an MCL or a meniscus, and it's kind of just a roll of the dice sometimes, unfortunately.
What about concussions? That's also kind of an injury that you'll see sometimes with sports.
Absolutely. Concussions are probably the biggest injury that we see because it happens almost nightly in a football game on a Friday. You'll see a concussion, or at a college game or whatever. But you also see it, believe it or not, in soccer a fair bit, and because they're not wearing helmets, and when as the kids get older and they're allowed to head the ball, they hit each other's heads, and you can easily get a concussion that way as well.
Dr. Yakin, how do people know that it's time to come pay a specialist like yourself a visit?
There's a couple of signs. One, if it's a major injury to a joint, if you popped your shoulder out of joint, if you know when you landed or got hit that I felt the pop, something went wrong, those are usually times to just come on in and get seen. If it swells, if the joint swells, absolutely you need to come in. That's body's way of telling us that there's something going on in this joint that's not right. And those are probably the biggest things. Pain, inability to bear weight if it's a lower extremity injury. And also the good news is that these kids have access to a lot of trainers nowadays that are at their schools, and they kind of guide them and know when something's not so serious versus serious. But things like ankle sprains, most of those can be treated by the trainer, but if they're not able to bear weight fairly quickly, or they're just having an excessive pain, then that's probably time for an x-ray. You can get little small fractures that can not be detected if you don't get an x-ray, and also a little fracture of what we call the base of the fifth metatarsal can be confused for an ankle sprain sometimes, and some of those do actually need surgery.
Now, when our kiddos come home from practice or games, if they're a little stiff or they're maybe complaining about some pain, what are some things we can do as parents?
Stiffness is very common after practice, and soreness in general. These kids are lifting weights, they're practicing, they're getting hit, they're bumping each other, they're twisting and cutting, and so they're going to be sore. I mean, that's kind of the nature of the beast. But if they're able to have full motion, like if you're complaining of elbow pain and they have full motion of their arm, that's a good sign. Now if there's limitation of motion, then that may be something more concerning. And if it doesn't resolve, then that's a good time to be seen.
Well, let's just say we have some parents of athletes who are watching us right now, and they're hearing this and they're like, hey, maybe I need to bring my kiddo in or my young person in to see a specialist like yourself. Where are you located and how can they do that?
Yeah, so our practice is Advanced Orthopedic Specialists. We're located at 3900 North Parkview Drive here in Fayetteville. We also have two other locations, one in Harrison and one in Rogers. And certainly if there's persistent pain, any limp, or if there's a history of an injury, then would be happy to see the kids.
Dr. Yakin, thank you so much for talking with us today. Kiddos, be safe out there this fall.
Have
fun, but definitely be safe out there.
And if it's aching, go see Yakin. Stick around, we got more Good Day in WA coming up right after this.
I don't think that's the first time we've heard that.
Probably not. Probably heard that a lot.